welcome everyone. Thank you so much for joining us for the very first of our community partner interview series. Before we dive into that, I just want to give a brief overview on the Healing Group Institute, and why we're doing these community partner sessions. The Healing Group is a specialty clinic that has been trying to make specialized care accessible to the community. Those areas of specialty are reproductive health, sexual health, relationships, and trauma. And as part of their mission, they wanted to give this confidence and competency to other clinicians, mental health clinicians, who want more knowledge and want more certainty when talking about sexual health. And a client brings up some reproductive trauma that they've experienced. So the Healing Group's mission is turning silent suffering into strength. And with that mission in mind, it is to not only instill confidence in our clinicians, but also building their clients up and building themselves up as well. And then a quick little background on why we have a list of community partners and why we're giving an interview is just that the mission and goal is to bring together providers with that holistic picture in mind. So it's not just the mind of a client, it's body, it's sexuality, it's really the whole image, the whole person. We have providers essentially in our directory, our Rolodex, that we want to refer out to, that our clinicians can collaborate with and consult with whenever a client has something that they might not necessarily handle, but they want to make sure they have a trusted resource to turn to when clients have these needs. So that's really the background of why we're doing what we're doing. We want to make the community healthier. And then right now, I want to introduce you to one of the incredible folks that we are doing this with. Today we have Danaya Kauwe with us, Dr. Danaya Kauwe, I'm sorry, Doctor of Physical Therapy, Certified Pelvic Rehabilitation Practitioner, and owner of Radiant Pelvic Health. I am going to hand the introduction over to you, Dr. Kauwe. So please give us that elevator pitch of who you are, what Radiant Pelvic Health does, and what that picture of who you serve looks like.
Okay, perfect. And you can just call me Danaya, so we don't need to be super formal, but thanks, Adele. So yes, I've been a doctor of physical therapy for 7 years now, and for 6 of those years, I've been specializing in women's pelvic health. So I do in-home pelvic floor physical therapy, and right now really focusing on pregnant women, postpartum, and postpartum and beyond, right? Like once you're postpartum, you're kind of always postpartum. So that's kind of my niche. What I'm specializing and treating a lot of now is these women who have had this major change or are going through this major change in their life and either need some help because they're experiencing symptoms, or they want to be proactive and stay strong and symptom free and prepare for their birth and before these symptoms start coming. So it's been pretty amazing to see that shift happen as well, where instead of just being reactive, some women are even starting to be proactive.
I was going to say, whenever I was going through pregnancy, that was one of my main concerns is like, I feel like before there wasn't a lot of conversation around pelvic health when it came to pregnancy. Like you said, it was very reactive. And I started to hear that conversation occurring more. And so when I was pregnant, I was like, oh my gosh, I need to start doing exercises and really thinking about these things, because I didn't want to end up not understanding what was going on with my body in postpartum.
Yeah. Yeah. And we have research now I mean, maybe you experience this too in mental health, but in physical therapy and like women's health in general, there's just a lot of lack of research. And when it comes to like pregnancy and postpartum, especially, there's not very much because it's hard to do research on pregnant women, right? Because of like ethical reasons. And so it was a very much like, just don't push yourself, don't try anything new, because we don't want to make anything worse. We don't know if anything worse will happen if you exercise or whatever it is. But we don't want to make anything worse. And so that was the mindset for a really long time. And now we're finally getting more research that's showing us that actually exercising when you're pregnant is really good for you and for your baby. It's like really great for your heart, and for like second stage in labor times are shorter and your recovery is easier. And when we're seeing all these positive things that are coming from the research that we're finally getting, of staying active during your pregnancy.
I love that. I love that insight, especially because, and I think I noticed this on your website too, that there's this whole idea that women have to bounce back
Yeah.
after pregnancy. And I love that it seemed that your focus is really working with understanding that I mean, there's people who do it, but also understanding that a lot of people aren't able to do that immediately.
Yeah. And it's never even like bouncing back. You're a new person. You have this new baby, like your life is different now. So
Mhm.
you can't really go back to where you were. And I don't want to go back. Like, and I don't want the women that I treat to feel like they have to go back. It's this new phase, and you can be strong and you can be resilient and you can be radiant, in this new phase of life, even if things are different.
Sure. Yeah, I love it. That's a term that we call matrescence, is that transition. It's like adolescence for mothers, where, it's a new stage of life and you might be going through it for a year, you might be going through it for like the rest of your life. And it's different with every child too. So I really love that that's a focus for you, and it's kind of why you do what you do. Can I ask what drew you into pelvic health specifically?
So I had my own experience with pelvic floor dysfunction and pelvic floor PT. I had never heard of pelvic floor physical therapy until I was in PT school. And I had my first baby my second year of PT school. And we had, you get a little bit of education in kind of the general program, but not a lot. So I had enough education that I knew it existed at least. And so after I had my baby, I was starting to have pain with intercourse. I was leaking. I had bladder urgency. I had diastasis. Like I had a lot of things going on that I didn't have before. And so I went to a pelvic floor physical therapist and immediately started seeing changes. And I was like, holy cow, how can this be so effective and be so unknown? Like more women need to know about this. And I want to be part of that, of that process, that change of it becoming more normal and more well known, that you can get help for these things.
Yeah. Are there like specific like age range of folks that you work with, or do you have a preference with that?
I work, I mean, with any adult, and if I have worked with some younger girls who like teens who have like endometriosis and have pelvic pain or pain with tampon usage or um, overactive bladder type of stuff. But really, my focus has mostly been on like adult women who are experiencing pelvic floor symptoms. So even if you've never had a baby before, there are a lot of women who have painful intercourse who aren't pregnant or postpartum, right? There's other reasons that can cause that. So just people who are having issues with sex, who are having issues with bladder, who are having issues with bowel, and then also throw in there like pelvic pain, hip pain, back pain, all of these things that can be coming from the pelvic floor. Those are the type of women that I specialize in treating.
So, in looking at that whole human, holistic picture, where do you see like the mental health piece showing up in the work that you do? Is it something that like your clients bring up, or is it something that you find you have to often draw out from them?
I feel like more often than not, I'm maybe not the first person to talk to them about it. Like they've maybe thought about it before, but I might be the first provider to say, hey, I think that you would really benefit from seeing a mental health therapist. Especially, I see it a lot with the the women that I treat who have chronic pain, or have pain during sex, and then postpartum with depression, right? So those ones often, there's a lot more checks now in place. I feel like of people checking in and saying, okay, I think you're dealing with this issue. So I'm usually not the first person to um, suggest seeing a therapist postpartum. Most of the time, they are already seeing someone, which is amazing. But yeah, it's usually the people who most of their symptoms have been physical, and there hasn't really been like a clear mental component to it. So they don't really think about how their pain is affecting them mentally.
Mhm.
So those are the type of people that I feel like I'm the first one to recommend seeing a mental health therapist.
Yeah, and that's, I mean, there's on the therapist end, there's that gap there where they're not sure, they're coming with the trauma of postpartum, or you talked a little bit about like the back pain and pelvic floor dysfunction, and they're not sure how to bring it up to the therapist, and then when they bring it up to the therapist, it's really like, who do we turn to next about this? So it's interesting that there's kind of like a gap in between both sides.
Yeah.
We just did a training the other day on it was body anatomy, but it was also under the umbrella of sexuality throughout adulthood. And someone brought up, and I think it was something that we just like don't even really think about, is when people are in perimenopause or going through menopause. Um, you know, they're maybe noticing some things in their body, especially their pelvic area, that they didn't notice before. So we had therapists who were like, I have people coming to me about this, and I don't know who to refer them to and bring them to. So knowing that we have, like a trusted partner in you, and this is something that you've seen before, coming from a therapist to you, I think is really, really important and really beneficial.
Yeah. It's interesting that you bring that up because that was something I wondered about was especially the menopausal women, because I know the physical changes that happen during that phase, right? With the decrease in estrogen and just like these changes in your hormones, how you do have a lot more of these physical symptoms pop up. I wondered if that was something that you guys saw that maybe they talked to you about, and it was like, I don't know, just like part of your awareness, and that they may benefit from that referral, because it is definitely like it's hard to feel good mentally if you're feeling all of these physical symptoms too, you know?
Totally. I feel too that like perimenopause right now, I don't know. I feel like for a while we kind of skipped over that term and went
Yeah.
straight from, I guess, motherhood or where you are. I mean, what would you say? What would you call that age between adolescence into adulthood, straight into menopause? There was no in between. No one talked about that gap of perimenopause, and I feel like there's more awareness now. So people are talking about it. They are wondering, where do I go from here? I'm not just
Yeah.
having mental changes; I'm having physical changes as well. And so, yeah, I think it is something that's coming up a lot more in the mental health community as well.
That's great.
Yeah. Um, so I guess then on the flip side is, what kind of clients or situations would you want referrals for from our mental health clinicians?
I would think the big ones that I think about are if they are having pain with intercourse. That's probably like the top one for, and this could be any age, right? You've never had a baby, you're pregnant, you just had a baby, or you're peri or postmenopausal. Um, all of those areas oftentimes are some sort of pelvic floor muscular component. So I think that one especially, it needs both. Because whenever I see people like that, I'm like, you also need to see a mental health there. It just needs both.
Yeah.
Um, so that's a big one. Other ones that I think would be great, for them to be referred on to me or to be referred on to a pelvic floor PT just in general is if they are having other pelvic floor symptoms like heaviness, like vaginal heaviness. This may be more common in the postpartum population, but they also might be postmenopausal too, because things are changing down there. So now they're feeling things differently. So vaginal heaviness, urinary urgency, feeling like they need to pee all the time. If they're all of a sudden leaking more, again, I'm still thinking of postpartum or peri or postmenopausal. They're actually very similar physical changes going on in our body, both in the postpartum phase and the like pre-post menopausal phase. We have similar changes. So the symptoms are very similar. So yeah, or you're now leaking more with exercise or coughing. I think those would probably be and constipation. That would be the other one. Those would be like the top ones that if your patients are dealing with things like that, there is certainly a likely physical component going on too that we could help with.
That's great. Yeah, that was going to be one of my questions is what do you wish that therapists understood about pelvic health before they refer someone to you? Um, and it sounds like you covered quite a bit of that, but is there anything else that you would want to add to that?
I think I would also add that pelvic health, it's not a box. It's not like, okay, it's only if you have pelvic symptoms should you be referred to a pelvic PT, because a lot of other people that I see are people who have gone to other physical therapists or other types of providers who were treating them for back pain, say, and couldn't get better. And then they come to me and it's because there was a pelvic floor component. And so sometimes it's tricky. It's not totally clear on, oh, this is definitely a pelvic floor symptom because I'm only feeling it in my back. Like, why would it be my pelvic floor? But that can be a component too. So that could be something else to keep in mind about referrals and just pelvic health is that it's not always so clear that there is pelvic floor involvement.
Yep. And then I wanted to ask before I jumped into, well, I was going to ask just like a couple personal fun things to wrap us up. But my last question before that is, do you have anything that you are pursuing or working on right now outside of your work in your practice?
So like something that I'm working on building like for my practice.
Yeah.
Um yes, right now I just do in-home.
Okay.
But it has pros and cons, right? I love being able to see people in their own space. We use the equipment that they have. They don't have to worry about childcare. And, like there's a lot of great reasons to do in-home.
Mhm.
But it does limit how many people I can see because I have to I have to be able to drive and I do all of Utah Valley. And so I have to have a gap to be able to drive to different people. So I am working on finding a place where I can do both. So I'll have some days where I'm in a clinic. I can see more people that way, but still keeping that in-home component because it is really valuable and kind of an underserved area where it's just not available. So it's not something I want to let go because a lot of women, it's really nice to have that option, but it does limit my time. So being able to do both is something that I'm working towards.
Oh, well, I wish you all the luck on that endeavor. That sounds amazing, and I'm just like blown away that you're doing this by yourself right now and driving from location to location. That's amazing. I'm sure people love that, but I'm sure it would be very nice for you to have that in well, what was I like in office location
Yeah.
too. Quickly before we wrap up, or maybe not quickly, but I wanted to ask something that we ask like a lot of our clinicians and just folks who join the healing group. It's just something fun is what's your favorite way to experience pleasure or play in your life?
Hmm. Um, Something that comes to mind is being outdoors. I went hiking with my kids last week, and that was the first time we'd been hiking this summer. And normally we go a lot more often. But for whatever reason, we've just been busy or whatever. We haven't hiked as much. And so we were out in the mountains and outdoors, and there's trees and there's rocks and there's a river. And um, just like how rejuvenating that was, and just how much I enjoyed being out in the mountains again. It was amazing. And it because it was the first time I'd done it this year, I think it hit me harder that I was like, wow, I really need this in my life. I really need to be outside and moving and being in the fresh air and just out in nature.
Oh, I love it. There's something so just rejuvenating about grounding yourself with with nature. That's great. And then really to close up, I wanted to ask, what is a good way for people to get in contact with you?
So you can find me at radiantpelvichealth.com. That's my website. And my phone number is 385-204-4135. So those are probably the best ways to get in contact with me. I also have an Instagram and a Facebook. They are both, they're at Radiant Pelvic Health and Wellness. So you can find me there, and I'm posting, hopefully helpful tips and information about pelvic floor on those too.
Oh, great. Yeah, we'll definitely make sure that we link out to you. We'll probably tag you in an Instagram post too so people can find you. But
Perfect.
is there anything else I missed that you would like to cover before we say goodbye?
I would say I hope more people are starting to become proactive. I think if you are pregnant, be proactive and get an evaluation before you have symptoms, because it can make a huge difference in your postpartum recovery and in your entire pregnancy journey. Um, if you are menopausal and just starting to get symptoms, right? If you can start sooner rather than later, don't wait for it to be so bad that it's, severely impacting your life. Let's get care before then. Let's start sooner.
Great. That's wonderful. Yeah, and that is how we continue to be radiant, right?
Yes. Love it.
Well, thank you so much. I will make sure that we get your information in our free community space. I'm going to give you access to that too. And if you have resources and links that you'd like to share with our community, I'm sure that they would love to have that. So, yeah, I will get you in there. And thank you so much for this conversation today. It's been
Yes.
very great.
Yeah, I really enjoyed it. Thank you, Adele.
Thank you.